Hi, good afternoon, everyone. My name is Plaxidis. I'm going to take you through the steps for respiration examination. Firstly, I'm going to talk to you about why we check respirations and in what conditions we check respirations, symptoms of a patient having some respiratory distress, and the management. So, usually, a patient suffering from acute asthma, could be some injury in the chest, like hemopneumothorax after stable wounds, or any infections, serious infections or sepsis. They end up with chest. Their heart rate, their respirations will be very fast. They'll present with sweating. So some of this will check. So to prepare for respiratory check, etc., there's 4 important things you need. You need a SATS monitor to check the blood gases in the chest, the amount of oxygen, Then you also need a stethoscope to listen to the chest, and you need a wristwatch where you can count the respirations. And usually in adults, it's 12 to 20 respiration. That's the normal respiration rate. So you need the SATS machine, stethoscope, and a news chart. So because you need to record the respirations. So what you do, you prepare yourself. Don't forget the infection control policy. You have to follow that all the time. Wash your hands before you touch the patient. Make sure you make yourself, you make the patient comfortable. Most of the wards now, they use the clinical examination room where all the equipment are always available. Take your patient, make sure they are comfortable. Though they are ill, make sure they are comfortable. You can ask them, like, are you okay? Let them take a seat. Sit up straight. Explain to them, I'm going to do this. I'm going to check your pulse, your SATs, and I'm going to check count your respirations, and I'm going to record as well, so that I can tell the doctor in case you need further intervention. Make sure your patient is sitting comfortable. You take your SATs. Make sure your equipment you are using, the stethoscope and the SATs, is clean. Put SATs on the middle finger. Wait 2 minutes. Make sure the fingers are warm. They're not warm, I need to wrap them. Put the SATS machine in. Wait until it's recorded. It will beep when it's recorded, so you take note of that. Respirations, you wait, count a minute. Like I said earlier, 12 to 20. Some people are specially trained, but usually in most cases the doctors, especially mental health services, mostly the doctors do the physical exam. That's where I work. Like in general, the specialist nurses who maybe do more things. So the doctor will listen to the chest. If there's any sounds in the chest, if there's any fluid, they will know. It will depend on how the patient is breathing. As a nurse, it's also important to check how the patient is breathing. How is it labored breathing? They might indicate pain, or you can ask them, have you got any pain somewhere? They'll tell you, on my lower chest. And usually with chest pain, we always worry. So the doctor should be called immediately because of the heart. So when all is recorded, when all is done, you record on the news chart. You score the news with other observations. In very ill patient, you might need to do all the 6 parameters for the observations. So can you score properly and let the doctor know. When you are done, tell the patient, oh, your respirations are too high at the moment. I have to get the doctor. Reassure the patient that the doctor may need to do a chest. Might need to use the stethoscope and may prescribe. So whilst waiting for the doctor, my patient might need a painkiller. If they are on their own some meds already, you can give them a painkiller. You don't want to give too much because you don't know when the doctor comes. They will decide on treatment plan. Make sure patient comfort. If they are sweating, they could be sweating, they could be anxious. You reassure them that all will be okay. The doctor will come in when you are all done, you clean your equipment again, put it away, and wait for the doctor. And whilst maybe the doctor is delayed or is dealing with something, you continue. If you are worried, you continue to keep an eye on the patient, observe if they are deteriorating. So in case of collapse, make sure on the walls we have the ILS, the emergency tray bags ready. So make sure all that is in place in case of collapse. They might need further management to be sent to acute care. So as you also to continue to check patient, monitor again and again and again until the doctor comes. Hope you find this helpful. Thank you very much.